Salairamanin. This session is on quantitative research methodology and your facilitator is Dr. Bushran Bar. When you start thinking of doing research, the first thing comes in your mind is what topic should we select? So this is the first and the most important thing that you have to do. You have to decide a research topic. And I believe this is the most difficult step because if your topic is something um, which is not needed for research, then your effort is wasted. It should be something which is needed and you have to explore a lot. You have to do a lot of literature review and discuss with experts in your field to come up with a good, innovative, and interesting topic. So how do you get ideas for research? What I tell to my students is that you start writing any problems that you face throughout your day. So it's starting with any problems that you face in the morning, then going to your college, taking classes, handling patients, and throughout your day, keep noting and writing the problems and do this activity for a week. Maybe you come across some ideas that you think that this issue has been unanswered still in the community and unsearched all still now, and it can sometimes give you topic for research. Then you do literature review, and we'll discuss today. Our most of the lecture today is on how and why to do literature review, literature search. Then when you do literature search, you read articles, and in the recommendation section, sometimes they give you ideas for further research and what is needed to be researched and what are the gaps in literature. Then you can take any national research priorities. I have just now shared a document in group, and this will give you an idea of what are the priorities in research in our country, and you can work on any of them. Then comes the local community problems. So I believe wherever you live and work, your priority in research should be around the problems of that community, which is your catchment population of your hospital. And it's best because you are knowing the population, you are living there, you have resources in terms of access to that population. So it's best to work on your own population and community with which you work and work on their health issues and their local problems. So you may have many topics in mind, which one to choose. So there are criteria for it. One is final criteria and other is so what test. So final criteria means it should be feasible, it should be interesting, it should be novel, it should be ethical and relevant. And what is so what test? It is a question, it is a hypothetical question that a reader will ask if they can't see why your research and your paper is important. So your reader will be asking, why should I read this research? Why should I care? And you should be able to answer the question till the end. Fine. So they will be asking you, what is the importance of this topic? You will say this, and they will say, so what? And you should be able to justify that the resources and the time that you have spent on this research, they are justified because this is something important and needs to be, and it needed to be explored in order to solve the problems of your community. I'm describing this with an example. So our example is parents' opinion about life skills education in schools. Is this feasible? Yes, I can easily get this data. I can visit the school maybe on a day where then there is parent teacher meeting, and I can ask them to give me information of what do they think about life skills education. So it's feasible for me. So it depends on your resources. Feasibility depends on individual resources. Is it interesting? So you can ask 2, 3 colleagues of yours if this topic seems to be interesting, and if they say yes, so it's something interesting. Is it novel? For this to know, you have to do literature search, and then you will find if the research has been already done in your setting, in your country, and if it has been done, then I think you can explore some other areas of research. And sometimes a research has been done in other populations and not in your. So even then it will be something novel because it has not been done in your population. So you need to do such researches for your population also, because every population is different, especially when it comes to topics like this social phenomena and cultural context. They are different population to population. Is it ethical? Yes. So ethical issues arise when you are giving some interventions like in our cities, or giving vaccines or therapeutic trials to one group and not to the other. That can be some ethical consideration. And here there are no ethical issues, and IRB helps to screen further. When you go further along this topic, then you take their help to guide you of what ethical issues can be there. Is it relevant? Yes, it's relevant to our field for community medicine, public health doctors, and to our community. It's relevant because life skills education, this is it's an issue which it's life skills training is needed for our community, and it's not something very much in vogue in our Pakistani population. So we need to do research on this.